Dr. Siklos is a woman that I came to know because she and my wife worked together for a period of time. Dr. Siklos, though, I have been trying to get her to do something in the synagogue for actually a couple years now. And this year we weren't going to be able to get her because she was doing the training for the March of the Living, and she was going on March of the Living, and she just didn't have the time to give to us. And the reason I wanted Dr. Siklos to speak to the synagogue is because she is an extremely bright woman and really an expert who specializes in anxiety. And even before this crisis, anxiety has been a rampant issue in our community. Not just the Jewish community. I mean, really modern society, anxiety has overtaken depression, and it is a real disease of the West. It is an epidemic that even competes with the coronavirus. But this virus outbreak really gave me the opportunity to seek out her wisdom and share it with the whole community, so that she could speak to us a little bit about managing anxiety, specifically with respect to youth, because that's her area of specialty. I imagine that there's going to be some generalizable principles even to adults. And I'm sorry that it's under these circumstances, but I'm very proud to share Dr. Siklos with the Shaare Zedek and the Vancouver Jewish community. Just a couple of programming notes. I have muted everyone except for Dr. Siklos. We're going to handle questions in the following way. You can either post them on the chat function on Zoom, or you can text them to Rabbi Philip Gibbs, who is Dr. Siklos' rabbi. We're doing this in partnership with the Harel Synagogue, of which Dr. Siklos is a member. Rabbi Gibbs is their rabbi. And Rabbi Gibbs is going to be handling some of the questions. So you can text those to Rabbi Gibbs. His number is 778-554-8241. I will try and put that into the chat as well, just in case anybody didn't get it. But it's on the poster that you received to get you to this particular program as well. So there you go. Camille put up Rabbi Gibbs's number. Thank you, Camille. And it is with great pleasure that I invite Dr. Siklos to start. Just one last thing. Dr. Siklos has shared with me a resource sheet. I will post that a couple of times in the chat, only because some people who started at the very beginning or came in late, sometimes they don't see all of the chats that come at the beginning. So this will be posted a couple of different times. Okay, Susan, Dr. Siklos, if you would please share with us your wisdom.
Thank you, Rabbi. Thank you. Welcome, everyone. I'm really happy to be here with everyone speaking. I mean, not directly with, but it was definitely motivation for me today to, actually take a shower and wash my hair and be presentable for all of you. So thanks for everyone for coming out. I know, these are really uncertain times, and as parents, this is really challenging in a lot of ways. And so my talk today will focus on anxiety in children in general, but also how to talk to children now, children and youth, specifically about COVID, about their concerns, about things like hand washing and social distancing, and what to kind of look for in terms of what we would say would be a normal range of anxiety, and what would be things that might be just a bit more concerning, and when you might, as a parent, want to kind of support your child or adolescent's anxiety. When I talk about anxiety in kids, I am referring to kind of the full age range, but obviously there are developmental differences between, preschoolers to school age kids to adolescents. So I will at times kind of highlight things for different age groups, what would be more specific to them or what would be more appropriate. But I do want definitely to save time for questions because I know that sometimes, I'll cover broad things, but sometimes as parents, especially during these uncertain times, there's specific questions that are coming up for all of us on how to manage our own specific kids or things that we're noticing our kids talking about or how their behavior is changing or all the stressors that are kind of coming up right now for people. So I will be saving time at the end to ask questions, and I really enjoy that part of it, hearing specifically what people are thinking and maybe questioning and struggling with. So in general, I mean, at these times in particular, a level of anxiety is very normal. And I think it's really important for all of us to recognize that, anxiety serves a function in all of our lives. It is an important emotion. It keeps us safe. It helps us, stay out of the way of danger. It helps us keep an eye out for danger. So, we all feel anxiety. And I think we all are to some level during these uncertain times. And anxiety comes up more during things that are uncertain or threats in our midst. And I think that is what we're facing right now. So, I think that it's important to keep in mind, especially in these early days, like we're in the first 2 weeks of, social distancing and break from school and all of those things. There's a normal adjustment period. And I think that, our own stress sometimes makes us worry for our kids. And so I think it's important in these kind of early days to be monitoring, and I'll talk about some things, how to talk with kids and what to be looking for. But, it's an adjustment period that we're all kind of going through. And so it's important to kind of normalize that for kids and be able to talk about things like, yes, we are all feeling a little bit stressed. To say like, yeah, I don't know what's coming. And some of this uncertainty makes me feel a little bit stressed. And it can be great to talk with kids about what are the things that you're doing around your own self-care to manage your anxiety. A lot of the times it's our more anxious kids in general that we're kind of watching more during these uncertain times. I mean, obviously, some kids, all of this just kind of rolls off their back and they're fine. I'd say our anxious kids who are already anxious to begin with prior to this pandemic, they're obviously more vulnerable, and we want to be watching them. And those are often kids who've had a more sensitive temperament from, a very young age. But sometimes at times like this, it's not the kid that you expected. Sometimes, the anxious child in your home is actually kind of doing okay. And one of the other kids who's normally totally fine is really feeling the stress for different reasons. And, I've seen things like, amongst my own kids, like not being able to see their friends, not being able to go play tennis at the tennis courts, these things that are kind of normal activities, definitely can create some disruption for kids. The other thing that I'll say too is that, a lot of us are anxious, and even before all of this, we may describe ourselves as a more anxious person. And as adults, kids feed off of their parents' anxiety, and they learn some of those anxious behaviors from parents as well. So I'll talk about this more later, but, monitoring what you're sharing or showing in front of your kids. I mean, I always talk about this when I work with anxious kids, and I always start off with doing some education about anxiety and, what does it feel like? What does it look like? Where does it come from? Why do we get it? And for most of my anxious kids, I'll say like, so for a lot of anxious kids, it's genetic. It comes from a family member. And I'll say to them, do you think like anyone in your family, like one of your parents or someone is anxious? And kids are bang on, like they will know. And they'll say, oh yeah, it's my mom or it's my dad. Like they're a total worrier. So kids know.
Susan, is that genetics or conditioning? Nurture or
It's
nature
both.
on that one?
It's both. We definitely know that it's both. So there's, anxiety can run in families for sure. So it's not always just a parent where they're seeing it, but it can be aunts and uncles, grandparents, and things like that. So some of that temperament aspect that comes in, but we also see it as modeling, and they're kind of learning from watching how their parents manage their own stress or anxiety. So I would say in general, when we think about what's normal anxiety and what's more what we're concerned about, normal anxiety, I'd say, is manageable with support, with parent support. So when you can kind of manage it at home, you can do, minimal reassurance, and we'll talk more about reassurance. You can kind of coach them around being brave, or challenging some of those kind of unhelpful, anxious thoughts or behaviors. That's within the normal range. When we're wondering about, is this something else? Is this getting a little bit too much? We're looking at things like the frequency of how often it's happening. So is this child talking about worries a lot? Are they hand washing, for example, excessively? We'll talk about that a bit. Are they kind of upset more and quite a lot of the time? We're looking also at the intensity of those emotions. So, we see there's a normal range. We all feel it sometimes, but what about when it gets like we're seeing really big reactions a lot of the time? And one of the biggest ones is interference. So is it interfering with your child's day-to-day functioning? Is it preventing them from having as much fun as they could be having? Are they avoiding places or people or activities because they're worried? Now, obviously, because we don't have free range in the world right now, sometimes it's harder to see that interference piece. But if you notice that your child is avoiding certain things, avoiding touching things, avoiding going outside, those kinds of things, those would be more where, it'd start to have some flags raised and be like, we maybe need to look at this, or we maybe need to talk about that a little bit. I think when talking about COVID,
just one thing on that. Is it possible that some of those anxieties are going to manifest in some unrelated things? Like sometimes, those are sort of what I would expect someone who's actively anxious about the virus. But should people be looking out for if it manifests in other places as well?
Yeah. And I was going to talk about that. So for example, those are the obvious ones, like avoiding things or being maybe more teary or things like that. Some of the other things, like in littler ones and little kids, looking at things like a regression in behavior. So, used to be able to like do these things on their own, and now they're not. Or really little ones, like suddenly they're having accidents when they've been toilet trained for a long time, or they're, for all the range of ages, sleep issues for sure is something to be watching. Is your child who used to be a great sleeper suddenly having a lot of bad dreams, not able to sleep, sleeping next to you or coming in at night? So sleep disruptions. Some kids most kids, I'd say, demonstrate anxiety as like an internalizing. It's an internalizing disorder. So they're showing teariness and avoiding things, and it's more like internal. But there are kids, for sure, who when they become anxious or distressed, become more irritable, more angry, more kind of punchy, argumentative, things like that. So, definitely anxiety can be at the root of things that lead to other kinds of behaviors that you want to watch for. And I think in general, at times like this, what you're really watching for is, has your child really shifted in some way? Like, was your child who used to be really like cuddly and now they're kind of, they don't want to cuddle, they want to be on their own? Have they kind of isolated themselves? Have they regressed in some way? Have they lost that kind of spark that they had a little bit? And you can just tell that they're more worried. Are they more teary at little things? And those are those times, and we'll talk more about what to do. But if you start to notice those things, those are those cues to kind of go, got to check in a little bit more with that child, regardless of the age, whether they're 3, whether they're 10, whether they're 16. You want to check in more and connect as a parent. And I'll talk about very soon about, different ways to kind of do that and connect in a way and open up those conversations to help them. So I'd say when talking specifically about what's going on right now in the world, the first thing I'd say as parents is to notice how you're coping and your own tone of voice or anxiety or how you're talking about it yourself. So like I said, children notice, they see it, they hear it, they're listening when you don't think they are. Are you stressed? Are you someone who in general, like germs and hand washing and sneezes around you, or you're somebody coughing near you, would that send you into kind of a big stress reaction? There's a lot of stresses for us as parents as well right now. And I think that's really important for all of us to look at and acknowledge and be doing self-care around, because our worlds have been, thrown. We're all working from home and our kids are at home. And that's a real challenge for many of us.
We're Jews. Our superpower is worry. So help us out here a little bit. That's my, I would like to say worry is my comfort blanket. So help me out here. Well, how am I supposed to deal with that?
Well, so a couple of things. One is it's normal to worry about these things at this time. But yes, as Jews, we can take it. We are definitely good at worrying. And so I think one thing is finding ways to care for your own worries. So learning, in the same way as I'm going to give you strategies on how to talk about worries with your kids and things that you can do, those same things can work for adults. So for example, if you notice that you're spending a lot of time ruminating, you're not sleeping, you're not doing so well, that's all going to affect how you parent, how you function in the day, your patience, all of those things. So you, first of all, need good self-care around your own worries. So being able to, some of the things that I recommend are being able to first notice that you're worrying, notice that you're spinning, and what do you need to do to kind of let that go. I practice a lot of mindfulness and teach my clients mindfulness because it's really, really helpful. There's a lot of good research to support using mindfulness. So the idea of getting focused in the right now, worrying is all about what's coming in the future. And worrying about it doesn't actually help you be better prepared for it. It's the trick of it. It makes you think that you will be, but you won't.
Can you just define mindfulness a little bit more?
Yeah.
I find it's something that's thrown around a lot, but I don't totally understand it.
Yeah. So, mindfulness is all about getting very present. In the simplest form, it's about getting present focused with, so being very aware in the present without judgment. And so things like meditation, but you could mindfully take a shower, eat your meal, cook and bake. There's lots of things you can do. And it's about being really presently focused on what is happening right now in front of you and in your space, rather than what's happening inside your head. And being able to notice what's happening in your head, to let it go without judgment. So to not be like, oh, there I went again. I was supposed to be baking and I was doing it all. And then my mind went and wandered. And now I'm so not good at this, right? That would be an example of how judgment comes in. Mm-hmm. And so you want to be able to just pull it back and be aware of your senses. So one of the examples I'll do with kids, I mean, a very simple one would be an activity that's called 5, 4, 3, 2, 1. So it would be notice 5 things that you see, 4 things that you hear, 3 things that you feel on your body. So not emotions, but feel. 2 things that you smell, and 1 thing that you taste. And as an adult, you can do that at any time in the day. You can just stop and notice that you're worrying and you're stressed out and go, okay, like right where I am in the car or on my walk or in the kitchen, like what are 5 things, what are 4? And with kids, I do more playful ones. So that's one I would do. And some kids love it. And sometimes to make it a little bit more physical, because kids aren't as still often at different ages, I'll have them like run around the room and show me 5 things that they see, and then 4 things they hear and like copy the sounds. Or so there's ways to make it playful for kids. Another one I do a lot with kids that helps with anxiety. It can help with when kids are getting really mad and frustrated or having a hard time regulating emotions, is one that I call Find a Rainbow. And so they have to be old enough to kind of know the colors, but you can cue them, the colors of the rainbow. And I'll just say, let's find a rainbow. Just stop where you are. And wherever you are, find a rainbow. Find something red, find something orange, find something yellow, find something green, and go through. And it just brings you down, because the whole goal is to bring you out of that busyness and chaos in your head and back into your environment and the space that you're in right now.
Okay. So Susan,
Yeah.
because I have teenagers in the house, and
Yeah.
there are 2 groups of people who I know are excellent at being judgmental, judging themselves and everything around them: Jews and teenagers.
Yeah.
So I can't do a 5, 4, 3, 2, 1. So what's your strategy for teenagers?
So for teenagers, I do sometimes teach some of the teenagers I work with some little bits of mindfulness, like even just taking 5 minutes to stop and do meditation with an app, because teenagers like technology. So things like the Mind Shift app, which was put out, it's on my resource list. It was put out by Anxiety Canada. And it's an app that's specifically for teens around anxiety. And there's things within that are kind of guided meditations or visualizations that can just kind of slow you down and still you. Or the Headspace app is totally appropriate for teens as well as adults. So that's kind of more around mindfulness for teens. The judgment, like judging themselves, the self-awareness piece, that we sometimes talk more about, like helpful thoughts versus unhelpful thoughts. And so we'll kind of talk about, well, that sounds like being able to label when they say something like that, to kind of label it and go, how is that a helpful thought? Like that sounds like one we need to let go of. That's a judgment. How is that helping you move towards where you want to be right now? And then what could we do that's more helpful or non-judgmental or reasonable or rational? So sometimes just getting kids to kind of label, or teens to kind of go, okay, let's put that one aside and be a little bit more compassionate to ourselves. And within mindfulness, there's good literature around compassion-based work as well.
Okay. I didn't know whether you want to go to some of the questions now, or you have more that you feel is important to just get out there.
I'll do just a little bit more, and then if that's okay, and then we can go to questions. So just in terms of like COVID specifically, I've linked to a bunch of articles, so I won't go into too much detail about how to talk about it. But, I think some of the important things are really talking to your child to find out what they know, what they think is happening, what their worries are, like really open up lines of communication with your child, correct myths. It's really okay to give them information, because the things with kids are that if you don't tell them anything, they make up things in their head that are probably far worse than is actually happening in the world, or the risks. So don't give them things beyond their developmental level. Don't elaborate. Like if they ask you a question, answer the question, but you don't need to give them a whole bunch of other information.
Wow, that's interesting. I wouldn't have thought that. that you should talk about it. But you're saying you need to make sure you're delivering the message, filling the space, and don't leave that as a vacuum.
Yeah, like ask the kids, ask your child, what have you heard? What do you know? What is your understanding of this? What is your biggest fear around this? Like that's what I ask both my kids and the kids I work with. Like what are you worried? And most of them they'll say, I'm worried I'm going to die. It sounds like that's what's going to happen. So, being able to give them information about actually kids do okay. Like for you, it'll probably be like maybe a flu or a cold, and chances are you'll be fine. Being able to tell kids that is really helpful to them. So giving them facts, but like not going above and beyond. We want to reassure our kids that we are doing everything that we can to be safe. Like we're putting these measures in place for safety, right? And that their role is to help us with that. I read an article, I couldn't find it before this to link it, but where, a parent was talking to their child as their kind of hero role in this to keep others safe is to kind of wash their hands, do social distancing, and that's their role. Like they get to be their own version of hero by not going to school right now and it's hard, but like also that's a really important role that your child is playing. So you want to give very simple facts, again, not like tons of information. You want to answer their questions with actual truth. I always say, do not lie to your children. It's not a good way to go. Even if your intentions are really genuine and really good as parents. I know our goal as parents is to protect our kids. We don't want them to worry. We don't want them to kind of stress about these things, but lying or saying things like, don't worry, it's going to be okay. You don't need to worry. Like that's not a helpful statement for kids. Rather being able to kind of go, like if you said you won't get sick and then they get a flu, then you've lied and they don't trust you, right? So you want to be truthful. Like, yes, it's possible. It's a very small percentage of kids that are getting this. It's actually a small percentage in the world of people who are getting this. Like if you present to kids the actual stats of what percent in each of these countries actually get sick and how many of those are truly actually like elderly people, for example, or things like that, that's helpful for kids to understand that, yes, like if I catch this, I will be okay. And I think that that's okay to say most likely we will all be fine. But also that very few of us, like as much as the challenge is the way the media and everything reports the numbers, it makes it seem big and scary. If the world reported every flu season, the numbers, the way our media does right now, that would be scary for all of us and kids as well. So I understand that this is important to, for kids to know that, there is an importance in social distancing. It's very important. It's very important to be practicing good hygiene and hand washing and keeping our space. But we also want to kind of give them that framework of actually what is the percentage of kids that, are getting, this is actually a small number and the rest is very low.
All the jokes on TikTok and Instagram helpful? Is that a tool that we can use to our advantage?
So those are tools we can use because of social connection for sure. I would say especially like one of my concerns for the teens in particular is teens are super socially driven and it's very hard for them to not be with their peers. So using things like TikTok, Instagram, Snapchat to make sure that they're not isolated and they're still connecting and they're not just staying in their rooms, not connecting to anyone in the world. That isolation, is more where I would be worried for teens. So using those to kind of connect, to like rally things up, but and to lighten everything a little bit, I think is fine. Yeah.
Okay, so I'm now going to give Rabbi Gibbs, maybe Rabbi Gibbs, just quickly introduce yourself, and then you want to start with some of the questions that you have.
Great. Yeah, so I'm Philip Gibbs. I'm the Rabbi Parel on in West Vancouver. So thank you for inviting me to be here tonight. And so I guess kind of one of the questions, which I think is trying to, that was from Howard, and trying to, I think, walk that line between being honest with your kids and, you know, kind of, I guess, trying to at least be that calming presence. You know, for example, like the question of how long will this last? In the way that, you know, we really don't know. Is it just being honest about that lack of knowledge, or is there a way to say, like, is it building up that lack of trust to then say, you know, it may be 2 months when it ends up being, you know, 3 or 4?
So as parents, I would say it is 100% fine to say, I don't know. Like, especially in this, none of us know. And, you know, people are speculating, and our kids are too. You know, my kids are asking all the time, like, are we going to go back to school this year? Like, I'm hearing we may not go back till September. And I'm like, I don't know. I'm not really sure. You know, I get that we hope that we get to go back, and it would suck not to, but, you know, I don't really know how long this is going to go on for. So we just have to do what we need to do now, and we'll see. And I think that that's a reasonable approach to take with kids. I think that, you know, to say, well, I think, you know, I'm guessing it's going to be like a month or two. I think it's easier to say, I don't know. And it's a good life skill for kids and all of us to learn to tolerate uncertainty. Like, that's hard. It's hard for all of us. It's especially hard if you're an anxious person to tolerate uncertainty, but it's a good skill to learn because there's a lot about life that's uncertain. And this is obviously like that escalated 100 times, but I think that, you know, being able to tolerate that and try and figure out, like, again, pulling it back to right now, like, what do we need to do right now to make life as good as we can make it?
Okay. And I guess similarly also, you know, I think someone was asking about in giving the data points. Is there, I guess, like a difference in trust in essentially which data you're giving? For example, if you know, to essentially say it's a very small percentage of people who are getting sick, you know, does that also then engender that sense of this isn't taken seriously? And, you know, in having that choice of, are you choosing, say, the alarming statistics versus the sort of comforting statistics? Is there a better choice in calming anxiety?
I wouldn't go to the alarmist statistics for calming anxiety. I think that when, you know, we're giving extremes of the, you know, the possible worst case scenarios, most anxious people go there in their minds on their own. So I wouldn't go to an alarmist perspective. I wouldn't either, like I said, minimize or try to downplay to any kind of extreme. But I think, you know, one of the tools I often teach anxious kids is something called detective thinking, which is like, let's figure out the facts in this situation. Like, we're worried that, you know, I'm like, for example, if the worry thought that a child has is I'm going to catch COVID and I'm going to die. Okay, well, let's look at the facts there. Like, what are, you know, what are the stats? Like, what are the chances? What else could happen? I could stay healthy. Like, you know, most kids have, like, okay, if I do catch it, what would happen? Okay, actually, the research shows that, you know, I'm healthy and I'm young and I'd be fine. Like, okay, so now that we've gone through the facts, like we played detectives, like, where are we at now? Like, what's maybe a more helpful thought at that point? Okay, maybe a helpful thought is, I'm probably not going to get it, but if I did, I'm probably going to be fine.
Right.
Right. So I think it is about balancing that. And in the same way of balancing, you know, your child's exposure to the news and media, making sure your kids are not, you know, watching the news all the time and getting super sucked into it, but rather being kids, because they don't really need to do that.
Right. Yeah, so I guess I have one more question, I think, that's really geared to anxiety, and then I think there's a few just sort of like general advice questions.
Mm-hmm.
And so something that I've been really curious about is how much is this experience really going to change the baseline of what seems, sort of acceptable and unacceptable, or not unacceptable is the wrong word, sort of behavior that may be taking a step too far. For example, in a year from now, if your child is if your child is washing their hands much more often, is that something that's just taking the normal health precautions that we're doing now? Or is that having this sort of lingering anxiety from this time at a time where there's not the same level of threat?
Mm-hmm. Yeah, and that's a really good question, and I've been thinking about that one a little bit. I mean, I truly don't know, in the sense of I can't predict the future. I think that it's something we've talked a lot about, because it's interesting from the perspective of, in some ways, we're teaching better hand hygiene than we typically obviously do, and kind of sticking to it in a way that we've not expected our kids to do. For example, like before school was out, when they were, I know my kids, for example, were washing their hands at school like 7 times a day now. Before meals, whatever, but some of the times are still what we've always recommended. We're just, there's a heightened level of, like, you need to do it when you come inside the house now, but there are people who do it anyways, and that this isn't necessarily a huge step up. I think that what we're going to be looking at after this is going to be, so the hand washing, when we worry about it, so it's usually linked to OCD-like behaviors, or obsessive compulsive disorder. And so a compulsive hand washing is always linked to an obsessive thought. And the thought is usually around germs. So if I don't wash my hands now, I'm dirty, I'm gonna get sick, I'm going to die. Like, that's often kind of how OCD works. And so it's the anxious thought that is fueling the compulsive behavior, and the hand washing is done to relieve the anxiety from the thought. So are we going to see more OCD specifically around hand washing? I don't know. I think that we might, and we will have to kind of monitor. So I think, I have to wash my hands because if I don't, something bad will happen, versus I have to wash my hands because that's what you're supposed to do, because that's good. So again, the difference there is what's fueling it.
Right. And probably the better question would be for something like social distancing, where right now, if I'm going out for a walk, I am terrified to essentially get within 6 feet of someone. And so, if that lingers, to a point where it's no longer necessary, it's the question of, is that something that's a precaution that maybe we should be having more distance with each other? Or is it just waiting for, I guess, the future medical advice of what's going to become a new norm, as opposed to, what really is this sort of, crisis response? Mm-hmm. And that's something that, I think we'll have to wait and see.
Yeah, I mean, we've had like bad flu seasons, and we've never, had any kind of social distancing or extra, a lot of, I mean, when it's bad flu season, people are talking about you need to wash your hands and you need to be, that kind of stuff. But we've never had social distancing measures before for other illnesses. So I think it will be interesting to see where do people kind of bounce back to, do people stay cautious, or do they go the other way where it's like, oh, what a relief, I can now walk on the street and not worry about high-fiving, Joe who lives down the street. I think it'll be interesting to see. But I do think as parents we'll need to watch those things and be talking to our kids about, the information, what is being recommended by physicians and World Health and all of those things after, you know, because we don't even know what after is. Like, is it things change, but they're still, you know, yeah, we don't know.
Right. And then, so I guess there are a few more questions specifically about anxiety. And one that I found really fascinating is if you do have, you know, a child who is somewhat anxious, but is also very intellectually curious, is encouraging them to, who's, you know, intellectually curious, is encouraging them to, like, you know, essentially do a sort of science research project about the virus. Is that something that's going to play into anxiety more? Or is it something that could help to calm it by understanding it?
I think so. It depends a little bit on the kid. There are some kids who the intellectual side really is a way that they manage their anxiety. Like they're really fact driven, and having facts helps them. The challenge is letting a child run rampant with research when there's so much out there right now that isn't necessarily scientifically backed. And depending on the age of the child and their kind of cognitive proficiency in those areas, to be able to kind of distinguish what is science and what is not. So it does depend on the age and that particular child. I think too much information can be confusing to a lot of kids and teens, and lead to an increase of anxiety because there's so much contradictory information out there as well. So I would be cautious about doing that. I think that if you had specific websites, like it was like, you know, only use, let's say, the World Health Organization's website or the CDC, and like give me some facts on like COVID right now today or something like very kind of focused, that might be doable. But I wouldn't want to let a kid kind of run on the internet with a project like that.
Yeah. Andy, go ahead.
Okay, yeah. You know, I know there's some parents on here who may have lost jobs, have it's no longer a future worry, but a real worry about, you know, income security, things like that. How do you, you know, if one of the lessons here is I need to manage this stress so I don't pass it on to my children, are there techniques there, or is that impossible to manage?
It's not impossible to manage. I mean, I think that, you know, it obviously, if you're in real dire financial situation, it's very stressful, and acknowledging that and acknowledging it to your child, like to be able to say, I'm stressed right now. Like, I don't know what's going to happen with my job, or I don't have a job right now, and that feels stressful. But to also be able to say to your child, but you know what, like, we always figure it out, and I'm going to figure this out. Like, you want your child to have faith that you are in control and can manage it. You want your child to be rooted in your stability. And so if your child sees you like, I don't know how to cope, I'm like in bed crying, that's hard for a kid. They don't know what to do with that, because kids rely on their parents to be their rock. Now, that's not to say you can't have breakdowns, but you want to try and keep them separate. You want to talk to your support people when your kids aren't around. You know, you want to go outside for that phone call. You want to go to your room to have a cry on your own. You want to kind of shield your kids from some of that stress so they don't take it on, because they will take it on potentially. Not all kids. I mean, some kids are totally oblivious and fine, but you want to kind of shield your kids from those kinds of worries as much as possible, while still being realistic. Like, you know, it's okay to say to your kids, you know, we can't get takeout right now because we don't have money right now. Like, things are going to be tight for a bit, but it's okay. We'll have what we need, but things won't be like they were for a little bit. And that's okay to say to your kids too. They're going to see it. They're going to notice it. So to be able to talk about it up front is a good way to go. And then, you know, if you find for you that your stress and anxiety around your new life situation is really taking over, finding support people, finding whether it's professionals to talk to, whether it's friends. There are things, there's a lot of web-based supports out there. You know, mindfulness, Anxiety Canada has lots of resources on their website on how to manage difficult things, some ideas for example, relaxation, imagery, mindfulness, meditation, dealing with your worries, you know, those kinds of things. So I would try to, you know, kind of contain that around the kids.
Yeah, and something that actually, you know, what you're describing is you're talking about the difference between, I think, hiding the facts from your kids versus hiding your emotional response.
Yes.
And so, you know, in some ways, to hide you crying on your own bed, you know, that's hiding the response, but still being able to say to them, you know, something like, no, we're not going to order takeout. And so, you know, I think there's the difference between, yeah.
Yeah, and to say, I am stressed about this. Like, to be able to say, I'm stressed, versus like in a calm, like, I'm stressed, this is hard, I'm going through some stuff. Like, I might be less patient, or I might, you know, need some breaks here and there. That's okay. Like, it's okay. Your kids can know we all have feelings. They're all normal feelings. But to be able to not show that you can't handle it, because that makes kids anxious and afraid when they feel like, oh, things are so bad that my mom can't handle this, or my dad can't manage this. That makes them feel fearful.
Right. And I think a breakdown is different from not being able to handle it. You know, it's needing that moment of release versus, you know, not being able to then step afterwards.
Absolutely. Like, to have some tears in front of your kid is totally fine. To say, I'm really sad about this. Like, and to be able to talk about it after. But to be like, you know, crying, for example, for days in your room and not be able to parent, like, that's kids, you know. So there's those levels of extremes versus kind of normal emotion.
Right. Where, I mean, but essentially in that second case, you know, that's more than just about coping strategies. That's actually needing, you know, a much more essentially robust support structure to ensure that you're able to take care of yourself so that you're able to take care of others.
Yeah, it's all about, like, as parents, it's those, like, the oxygen masks come down, you have to take care of yourself first. You cannot parent if you're not taking care of yourself.
So Susan and Rabbi Gibbs,
and so
we've packed a lot into this evening, and we have an update from our doctors about the virus. Susan, I can't tell you how much I've gained from this, and how much I appreciate your sharing this with our community. Also, I just want to thank Rabbi Gibbs for very insightful questions and your own reflections. And I'm really glad that you joined us on this